You take medication to feel better, but why do you feel more exhausted every day? This is a question many patients ask me in my clinic daily. Are your prescriptions a life-saving remedy or a silent thief? Today, we uncover the hidden reality of how common medications can actually drain your vital energy. I am Dr. Megan Foster. Today, we will discuss drug-induced nutrient depletion, a phenomenon where treatments silently steal essential micronutrients from your body and your blood. This depletion often causes severe exhaustion in the elderly, which is frequently misdiagnosed as just a natural part of aging when it is actually a deficiency. Understanding this mechanism is the first step to reclaiming your vitality. We need to look beyond the symptoms and address the underlying nutritional gaps created by medicine. Many of you are taking these pills for chronic conditions like heart disease or diabetes, unaware of the hidden cost to your body's nutritional balance and health. Time is of the essence. Let us dive deep into the 5 types of micronutrients that are being stolen from your system by the very drugs you trust. Medications do not just target the disease, they also alter how your body absorbs, stores, and excretes essential nutrition every single day through complex chemical interactions. Think of it as a barrier. Some drugs physically block the pathways that vitamins use to enter your bloodstream, leaving your cells starving for the fuel they need. This isn't an immediate side effect like a rash or a headache. Instead, it is a slow, methodical erosion of your health over months and years of use. Our data shows a significant difference in micronutrient levels between those who take long-term medication and those who don't, even with a similar healthy diet. Your liver and kidneys have to work harder to process these drugs, often using up your body's own supply of antioxidants and minerals in the process. The result is a silent deficiency. You might feel fine at first, but internally your body's reserves are reaching dangerously low levels without you even realizing it. As a doctor, I see the consequences of this neglect. It is time we change the conversation from just managing disease to maintaining total body health. Let's break down the specific drug categories that are most likely to cause these issues, starting with the most common ones used for heart and blood. First, let's talk about statins. These are essential for lowering cholesterol and saving hearts, but they have a hidden cost that we must address immediately. While statins block cholesterol production, they simultaneously block the production of coenzyme Q10 or CoQ10, which is the primary energy source for every single cell. Without enough CoQ10, you might experience muscle pain, weakness, and a general feeling of fatigue that makes everyday activities feel like an impossible mountain to climb. Ironically, the heart is the most energy-demanding organ. By depleting CoQ10, we might be weakening the very organ we are trying so hard to protect. If you are on cholesterol medication and feel your strength fading, it may not be your age, it could be your cells crying out for CoQ10. Second, we look at metformin. This is the gold standard for managing type 2 diabetes, used by millions of people worldwide to keep blood sugar stable. However, metformin significantly interferes with the absorption of vitamin B12 in the intestines. B12 is crucial for nerve health and the production of red blood cells. This often leads to peripheral neuropathy, tingling or numbness in your hands and feet. This is frequently confused with diabetic complications when it's actually B12 deficiency, i.e., lack of B12 also causes memory fog and mood changes. We often see seniors misdiagnosed with cognitive decline when they simply need more of this vitamin. Maintaining this balance is critical. You shouldn't have to choose between stable blood sugar and a healthy nervous system. We can manage both with the right approach. If you take either of these medications, please listen closely to the next sections. Knowledge is your best defense against these silent nutrient thieves in your body. Do not ignore the signs your body is sending you. Fatigue and muscle aches are not just getting old, they are signals that something essential is missing. Now, we move to the third group, diuretics or water pills, commonly used to treat high blood pressure and fluid retention in millions of seniors. These drugs work by increasing urination but they don't just flush out water. They also wash away vital minerals like magnesium and potassium that your heart needs. Low magnesium can cause heart palpitations, anxiety, and painful leg cramps at night. It is a critical mineral for over 300 biochemical reactions in your body. If you wake up with sudden, sharp muscle cramps, your blood pressure medication might be the culprit. Your muscles are literally starving for these essential minerals. Potassium is equally important for heart rhythm. When it is low, you might feel weak or experience a fluttering sensation in your chest that is quite frightening. Fourth, we must discuss proton pump inhibitors, or PPIs. These are common over-the-counter and prescription drugs for chronic heartburn and acid reflux. You need stomach acid to unlock nutrients from your food. When PPIs suppress acid too much, your body cannot absorb calcium, magnesium, or even vitamin B12. Long-term use of these medications is strongly linked to an increased risk of bone fractures and osteoporosis because your bones aren't getting the calcium they require. It is a cruel irony that trying to fix your digestion can lead to breaking your bones. We must find a way to balance acid control and nutrition. Many people take these daily for years without knowing the risks. If you are one of them, it's time to reevaluate your long-term digestive health strategy. I am not saying stop your medication, but I am saying we must be aware of what is being taken away from your body's vital stores. From hearts to bones, these medications affect everything. But we still have one more group to cover that is just as common and just as dangerous. Finally, we have NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen or aspirin, used by almost every senior for chronic joint pain or arthritis. Regular use of these can cause microscopic bleeding in the gut. While you might not see it, this leads to a steady loss of iron and folic acid. This leads to anemia, making you feel weak, dizzy, and short of breath. Your blood literally loses its ability to carry oxygen to your brain and muscles. Folic acid is also vital for cell repair. Without it, your body can't heal the very inflammation you were trying to treat with the medication originally. It becomes a vicious cycle. You take the drug to stop the pain, but the drug causes a deficiency that prevents your body from truly healing itself. We must be extremely careful with long-term use of these common painkillers. They are not as harmless as their over-the-counter. Status might suggest to you, if you feel more tired after taking your arthritis meds, it's not in your head. Your body is losing the iron it needs to keep you going. I know this sounds overwhelming, but there is hope. We are now going to discuss how you can rebuild your body and protect your health. The good news is that we can compensate for these losses. Nutrition and smart lifestyle choices are your most powerful tools for recovery and lasting health. Nutrition is the key. If you are taking statins, focus on foods rich in CoQ10 like fatty fish, organ meats, and whole grains for cell energy. If you are on blood pressure medication, increase your intake of magnesium-rich foods like almonds, spinach, and dark chocolate to support your heart and muscles. For those on metformin or PPIs, vitamin B12 is your priority. Look for high-quality animal proteins, eggs, or talk to your doctor about high-absorption supplements. Here is a quick guide. Take a screenshot or write these down. These foods are not just fuel, they are your medicine's best partners for health. Remember, nutrition does not replace your medication. Instead, it helps your medication work more safely by protecting your body from these unintended side effects. Eating right is a form of self-respect. It is the foundation upon which your medical treatment should be built for the best possible long-term outcomes. Sometimes diet alone isn't enough, especially if the depletion is severe. In these cases, targeted supplementation under medical supervision can be a real lifesaver. I recommend getting your levels checked at least once a year. A simple blood test can reveal exactly what your body is missing right now. You have the power to change how you feel. It starts with one small change in your diet and one important conversation with your healthcare provider. Don't accept fatigue as your new normal. Reclaim your energy by giving your body the building blocks it needs to function at its very best. Every morning is a new opportunity to nourish your cells. Let's make sure they have everything they need to support you through your golden years. Now, let's talk about how to speak with your doctor. Most physicians are busy, so you need to ask the right questions to get results. Question number 1. How does this specific medication affect my micronutrient levels? Make them aware that you are concerned about your total nutritional health. Writing it down helps you stay focused during the visit. Your doctor will appreciate your proactive approach and will take your concerns more seriously. Question number 2. Do I need a blood test to check for vitamin or mineral deficiencies? Don't guess. Get the data you need to be sure. Objective. Data is the best way to tailor a plan for you. It takes the guesswork out of supplementation and ensures you're getting what you need. Question number 3. Are there specific supplements or foods that fit my current treatment plan? Always ask before starting any new vitamin or supplement routine. This ensures there are no dangerous interactions between your supplements and your meds. Safety should always be your number 1 priority in any health plan. When you ask these questions, you transition from a passive patient to an active partner in your own care. This is where true healing begins. Do not be afraid to advocate for yourself. Your health is your most precious asset, and you deserve a medical plan that supports every part of you. Take these 3 questions with you to your next appointment. They are the keys to unlocking a higher level of care and a better quality of life. We have covered a lot today. Remember, exhaustion is not a required price for getting older. It is often just a sign that your body needs help. Understanding your medication is the first step to reclaiming the energy and vitality that is rightfully yours. You can live a full, active life at any age. I am Dr. Megan Foster. It has been a pleasure sharing this knowledge with you. I wish you health, happiness, and a proactive approach to your well-being. If you found this helpful, please share it with a friend. Let's spread the word and help everyone live their healthiest, most energetic lives possible. Your health is truly in your hands. Take the information you learned today and use it to build a brighter, stronger, and more vibrant future, starting now. Stay active, stay informed, and most importantly, stay healthy. I will see you in the next video for more tips on living your best life.